With several hundred people dead and more than 28,000 people and counting infected with the deadly coronavirus, the World Health Organization has now designated it as a public health emergency of international concern. Only the fifth such announcement has been made in a decade. People are worried and panicked by much of the information being circulated about the virus, but what exactly is the coronavirus? Where did it come from? How is it spread? Is there a cure?
So the coronavirus is a new species of an existing virus known as the coronavirus, which has now been renamed 2019 novel coronavirus.
Right.
But it's a pre-existing virus. The difference, though, why is it new? Because this normally occurs in the animal kingdom, generally, and now what we've seen is a jump from the animal world to the human world. And so that is unusual. So the human race has not encountered this virus before.
The mode of transmission is droplet infection. It means that if you sneeze in a room, if you cough and there's several persons, you can affect and infect several persons at the same time. So the spread is really what the issue is.
So the coronavirus is a virus, and to date there is no vaccine available, period. Okay? So they're quickly working on that, and the hope is that within about another 6 to 8 months, we may have a vaccine available, because it has to go through various testing phases.
On December 31st, 2019, the World Health Organization's China office heard the first reports of a previously unknown virus behind a number of pneumonia cases in Wuhan, a city in eastern China with a population of over 11 million. How did the coronavirus start? From all reports, the virus appears to have originated from a Wuhan seafood market where wild animals, including marmots, birds, rabbits, bats, and snakes, are traded illegally. Coronaviruses are known to jump from animals to humans, so it's thought that the first people infected with the disease, a group primarily made up of stallholders from the seafood market, contracted it from contact with animals. Although an initial analysis of the virus suggested it was similar to coronavirus seen in snakes, it now seems more likely that it came from bats. Some early cases of coronavirus, however, appear to have infected people with no link to the Wuhan market at all, suggesting that the initial route of human infection may predate the market cases. By the time the Wuhan market was shut down for inspection on January 1st, it appears that the coronavirus was already spreading to beyond the market itself, because 20 days later, the WHO Western Pacific Office said that the disease was also being transmitted between humans, evidence of which is apparent after medical staff became infected with the virus. Since then, and in spite of a de facto quarantine of the epicenter Wuhan and some surrounding communities, at least 563 people have died in China, which means that the death toll from coronavirus has now exceeded the SARS outbreak in 2002 and 2003. 2 people have also died outside of China. So, how can people prevent the spread of the coronavirus?
Okay, so personal hygiene is the primary form. Hand washing. And not just wetting of hands, but literally washing hands with soap and taking a little more time to wash your hands. You would notice that they say if you sing the birthday song twice while you're washing your hands, and that should be enough time to make sure that if the virus was on your hand, you would have taken care of it. Things like not putting your dirty hands in your eyes, your mouth, your nose, your face, those areas, because the virus can go into your, what we call the mucous membranes. So personal hygiene is the primary way of preventing the spread of it.
No cases of the coronavirus have been detected in Barbados as yet, according to Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostick. But bar travel restrictions of visitors arriving from China, as has been imposed the position of other countries, he says Barbados is putting measures in place to keep out the deadly virus.
Right. So, unfortunately, just like any other viral illness, we will often have fever, cough, and potentially shortness of breath. So far, really the way we define it is anyone who has had either been in Hubei, Hubei province, or coming from the Wuhan city, where the epidemic first started, presenting with fever and cough will be presumed to have the infection until proven otherwise.
Okay.
Yeah?
With no known cure, the ministry has instituted very strong surveillance measures at the island's ports of entry, which has so far proven very effective. On top of that, any person entering Barbados from the affected regions who show no symptoms of the illness are quarantined for 14 days. In the event that travelers exhibit symptoms, they will be immediately isolated. In the event that the virus does reach our shores, after a tour of the island's infectious disease facility at the Enmore complex, Bostic gave the assurance that the Health Ministry has the equipment and expertise to keep Barbadians safe.